Hello, everybody, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me today is Dr. Stephen Wasemiller, and I'm excited to have you in today because you're another North Dakotan that gets to be on the podcast with me.
Yes, one of the few.
I don't know why there's always been the rivalry between the Dakotas, right?
Yes.
When you live up in North Dakota, you hate South Dakota and vice versa. But
they teach it in the schools.
They do, honestly. So you're originally, let's just get some background on you, Doctor.
Yeah.
Like I said, you're originally from North Dakota.
Yep.
So what started this whole journey for you to be a non-invasive cardiologist?
Oh, mercy. Okay.
Yeah, let's just dig in.
So my father's a doctor as well.
Okay.
He's a practicing general surgeon in North Dakota still, and so I was exposed to medicine from a young, basically my whole life, multiple family members and so forth. So it was kind of on my mind about career choices, things that I could do with my life, and
right.
that, I went through my high school, undergrad, and I decided to do pre-med and applied, and then I attended Loma Linda University School of Medicine in Loma Linda, California. That's where I did my my MD, my medical school training, and then fellowship or my residency in internal medicine was there as well. And then I did my cardiovascular disease fellowship at Penn State Hershey in Pennsylvania.
You went and crossed the entire country to get this stuff done.
I did.
Wow.
I did. It's
what's a journey? What's that like? Why do you have to span the country in order to?
Well, it's a cardiovascular disease is first of all, I wanted to go somewhere different. So just for me personally, I wanted to go somewhere where I would have a different perspective on the field of medicine as opposed to just being siloed into one institution. So that kind of explains why I, traversed the nation to go to a different location and pursue medical and cardiovascular training. Because, the cardiology program at Loma Linda is great, and the people there are wonderful. But I wanted to know how things worked at another place, and so
sure.
That's why I ended up out there.
Well, what is the difference between, because it says, on your bio at Monument Health that you're non-invasive. So can you explain that a little bit?
Yeah, so they don't let us use knives or needles. No,
but would you if you could?
Oh, absolutely not. There's a reason why I'm non-invasive. No, seriously. So a non-invasive cardiologist is what's commonly referred to as a general cardiologist. This is an individual who has specialty training in cardiovascular disease. And often are trained in other diagnostic testing, such as interpretation of stress testing, EKGs, Holters, echocardiograms, and then diagnose and treat patients with interventions, either medical or non-medical, in clinic. I am what would you call a non-cath interventional non-invasive cardiologist. So I don't do cath procedures. That's a question I often get.
Sure.
But I do other, technically invasive tests with a transesophageal echocardiogram, where you do an ultrasound through the down the throat and so forth. So there's different flavors of it, but generally speaking, that's what I do. Okay.
Well, we have you in here today, Doctor, because February is going to be National Heart Month. So we wanted to bring you in to talk a little bit about kind of generally just a heart healthy lifestyles, right?
Yeah.
And I think it has to begin for a lot of people. Because if somebody is going to hear this podcast and they're going to think, all right, I'm going to make the decision to do better for my heart, right? The mindset and emotional health has to be a big influence on this, right? To get into that healthy heart, just to get ready to go.
Yeah. So I'll caveat this by saying, first of all, you think of heart healthy as, there's one thing I need to do. I need to eat better. I need to exercise more. I need to lower my cholesterol. Well, we've kind of found out over the past, several decades of research that have been done in the area about how so many other aspects of our lives play into cardiovascular health. And it's becoming, much more commonplace to see folks emphasize things like stress reduction or stress mitigation, healthy sleep, social networks, being socially engaged in your community and whatnot. And it goes so much more beyond just diet and exercise. I think we kind of have this reductionist approach to cardiovascular disease where you may have an individual that comes in and says, I'm so mad, my cholesterol is high. Okay, that's one piece of a much broader puzzle. And it goes so much more into just getting your cholesterol down or just eating right. Those things are good things, but unless you're tackling the whole breadth of your lifestyle, then you're going to be running into a lot of trouble because you're going to be forgetting a lot of things that are critically important that you may not come to mind.
Right. I'm just, as you were saying that, I'm thinking that we all know, you all learn that your heart is a muscle,
Yep.
like the rest of the muscles in your body.
Yes.
That happens to pump the blood throughout the whole thing. Why, when you get stressed out or you worry or you have anxiety or you have kind of mental issues that can correlate to having a bad heart, why is your heart so specifically affected? The rest of the muscles in your body aren't, right? And maybe I don't know if this is a question you can answer, but
well, I tell people every organ in your body that has a blood vessel is affected by cardiovascular disease by definition. Okay, so everything in your kidneys, your spleen, your stomach, your lungs, your brain, all these organ systems have blood vessels. They're affected by blood pressure. And blood pressure itself is one variable that's affected by a number of different things, different variables in your life, not the least of which are, stress, lack of exercise, and so forth. So I don't know if that's a great way of answering that, but as far as the heart being a muscle, yes, it is a muscle, but it's a fairly complicated one.
Sure.
So,
right.
I guess, I don't know if that answered your question,
right.
but
no, I again, this was one of those. It was just kind of a little off the topics that I had here, but as I was thinking about it, because like you've said, we've learned so much about what stress and anxiety and mental, how your mental state is can affect your heart.
Yeah.
So if people have conquered that now and they're ready to jump in and do something right for their heart, are there specific, like you kind of mentioned a few, but top lifestyle changes and let's talk about anybody, age, fitness level, whatever.
Sure.
What are some of those things that you can start to implement?
Okay. Yes, that's a good question. So, first of all, I also caveat this by saying, but I personally do not adhere to every single thing I'm suggesting. So just a little humility on my part is, just because we're in cardiovascular disease doesn't mean we're eating celery sticks every day.
Of course.
But that's a good question, because there are a lot of questions we get as what do I need to do? Okay. And the obvious ones, you talk of heart healthy diet and you talk of exercise, and there's a reason those are commonly touted ways to improve your cardiovascular health. It's because it's been proven. One of the recommendations, the American Heart Association recommends at least 30 minutes of exercise, moderate activity 5 days a week. So that's things like brisk walking, water aerobics, gardening, dancing, and then or 25 minutes 3 days a week of vigorous activity, so like uphill hiking, rapid cycling, that sort of thing. So now exercise. So I'll kind of take this down in pieces, because there's several different pillars, so to speak, not my term, pillars of lifestyle medicine. Exercise being one. So exercise does not mean you have to go to the gym. Okay. Going to the gym is great. If that's a place that you find you get motivated to do physical activity, that's wonderful. There's a lot of my patients that love swimming. They love doing CrossFit. They love doing a lot of different types of exercise. But exercise is not just limited to a gym. Exercise could include just taking stairs instead of elevator, for instance. Or for some people, maybe it just means, maybe I walk to the mailbox today, to someone who can walk to the end of the hall. So I can get to the end of the hall this week. I'll get to the mailbox by next week. I'll get to maybe the end of the block by the following week. Just because, you are told to exercise, sometimes we need to reconceptualize what exercise truly is, because we always envision, these muscled individuals in a gymnasium pumping iron and running and all that sort of thing. But you need to start where you're at, okay? And I tell people, it's like, because people ask me, what's the best exercise regimen? So do I do jujitsu? Do I do this? And it's like, the best exercise regimen you can do is the one you actually do.
Right.
Because, it's great to have, videos of P90X or whatever you choose to do in your computer or whatever. But it start where you're at.
Yeah.
And show yourself some grace too, because, we are all our own worst critic. So if we're constantly beating ourselves up about how much we're not doing, we're not going to be necessarily motivated or wanting to have that positive change.
Right. So
that's a little piece on exercise. Now, diet, there's a whole, that's a whole podcast.
Oh, it is.
So,
alone. What I was kind of going to ask you about it was more of the, because everybody knows you got to eat right? You do. You know that there are certain things that are good for you, but even like you said with exercise, you just kind of start where you're at. Mix in some vegetables, mix in some fruits, some things like that. So, do you have misconceptions about it instead of
yes,
what people maybe believe that you would like to?
So there are some misconceptions, and in truth, not all misconceptions are totally off base. There is, for instance, about one of the common misconceptions is that eating healthy is expensive. That's not necessarily true. You can certainly go gangbusters with any type of diet, healthy or otherwise, but it does not necessarily need to break the bank. And I am certainly sensitive to the fact that a lot of people nowadays, money is not readily available. People don't have a lot of cash on hand to just, say nothing of like buying a gym membership or doing what have you. But especially, everyone eats, okay? But it doesn't have to be expensive. Frozen vegetables are not expensive. This is actually a place where you can buy a lot of homegrown foods, or you can find homegrown foods at farmers markets, or there's a lot of ways that you can get around with. You don't have to just eat expensive fresh organic berries or whatever it is from wherever. So that's a common misconception. And then one is not so much a misconception, but it maybe just be misguided focus is eating what's called white meat. So now things like fish, chicken, those types of things over red meat. Now I will say it is technically better than red meat. So, consuming red meat has been shown to be more harmful and can increase your chances of having atherosclerotic disease and colon cancer in men and that type of thing. But it's kind of a continuum. So, white meat is better than red meat, but, vegetables are going to be much better than white meat.
Yeah.
That's an example. And then there's kind of along the same lines with the exercise discussion is, because people ask me, what type of diet do I eat? What type of diet should I embody? And my answer is the diet you use, the diet you stick to. And a common diet that that is heavily based and founded in eating whole foods and other foods that aren't in plastic packaging.
Yeah.
So things like fresh vegetables and that sort of thing is the Mediterranean diet. There's a lot online about the Mediterranean diet and what it means to and what it's based on. Leafy green vegetables, nuts, legumes, and those types of things. Lean fish, those types of meats as well. So there's a lot out there, but again, it's the diet that you consistently adhere to. That's going to be important.
Sure. Okay. Did you want to go through the rest of those pillars on there really quick, Doctor?
Oh yeah. So for those of you who don't actually know, there's actually the American College of Lifestyle Medicine is something that puts out a lot of recommendations about healthy lifestyle as it pertains to medicine. So some of the other, and they have 6 main pillars they talk about. So diet, exercise, tobacco and alcohol reduction. Of course.
Yeah.
You knew that was good.
Oh, smoking for sure. That's kind of become a running theme through here is whenever I have a doctor in and they'll say, now here are the things you should avoid, I can say, can I just guess the first one?
Yeah.
It's always smoking.
Yeah. So those are the 3, okay. And then stress management, sleep, and then healthy relationships. Okay, so we already kind of talked about diet and exercise. Yeah. So tobacco and alcohol reduction, it's 2024. It's kind of a no-brainer. I mean, a lot of my visits, I actually don't really even address tobacco, surprisingly, because it's like, good morning, sir, the sky's blue today.
Right.
And so, and I'm understanding of the fact that how very, very difficult it is for people to stop smoking. And there are resources available, and we are ecstatic when people are able to get off of cigarettes. But, telling people that it is bad for you is, yes, we know that. And I think that's a vestige of the way, a very prescriptive form of medicine was practiced in years ago of, I tell you to do this, as opposed to, how can I partner with you to accomplish your, not just this thing, but how do I accomplish you to have a healthier life? And in doing so, perhaps you may quit smoking, type of thing.
Right. Well, we've always heard on the alcohol side of things, though, that there are certain alcohols that are good for your heart.
Yeah.
But I think we've learned over time now that how much of that is actually true?
So, there is some evidence that does talk about alcohol, and they specifically say, and there are some studies that have said that drinking things such as red wine,
right?
I would say that it's probably better than drinking other types of alcohol, but the best type of alcohol consumption would be no alcohol consumption, and it's a balance, right?
The red wine is always touted as, hey, that could be a heart healthy thing. And I suppose that's better than a Coke.
Yeah.
In moderation.
And define what's better.
Sure.
And that's a good question because better to you may not mean the same thing as better to me.
Right.
There's, with anything you consume, there's going to be sugars, there's going to be calories, there's going to be that metabolic effect that the substance or food or drink or whatever it is that you have that takes it that you take in.
Right.
it's the safest amount of consumption of alcohol is obviously 0,
Yeah.
but this is the real world, and I'm sensitive to
Sure,
that.
of
You know,
course.
I definitely understand that. There are some ways that people can regularly partake without going overboard,
Yeah.
or causing a drastically significant amount of effect on their diet.
Right.
The recommendation is no more than 2 drinks per day per men, and no more than 1 drink per day for women.
Right.
That's a generalization. Each individual may have a different need or a different risk of alcohol use. So before you would say, oh, I can drink 2 drinks a day. I heard on the podcast that you could drink 2 drinks a day.
That's
So
not what he meant.
always discuss this with your doctor before you would modify your habit like that.
Now, you went on to sleep was the next one on there,
Sleep,
which
yes.
seems to be becoming a bigger and bigger deal as well.
It is a big deal. And because sleep impacts a lot of body process that we don't understand, or that we don't think of. We're understanding more and more. One of the biggest things that we see in cardiovascular disease specifically is the incidence of sleep apnea in folks that have atrial fibrillation.
Mm-hmm.
So, one of the greatest risk factors is uncontrolled sleep apnea, high blood pressure, and that sort of thing. Because sleep apnea and poor sleep habits in general leads to a lot of dysregulation in body processes that can predispose you to having other health problems. The recommendation, based on a lot of the studies that I've read, is around between 7 to 8 hours a night. Some people say I can get by with 4 a night or 5 a night. The people that genuinely can do that with no physiologic consequence is very small. There's actually some health detriment if you get less than 6, or health detriment if you get more than 9.
That's
so
what's crazy. Yeah,
so
to go too far.
There is a bit of a balance with that. And obviously it's important for maintaining memory and those processes as well. So those stress management. So if you don't mind, I might just touch on this a little bit too. So stress actually is another not commonly thought of thing, especially in 2024 United States. Life in the modern era is very
just stressful,
very hard. It's genuinely hard on people, and there is a significant. There is evidence to say that there has been significant associations of stress in cardiovascular disease. Mm-hmm. I think of a condition we often see in the hospital, usually after a understandably stressful event like the death of a loved one, or sudden shock and surprise of what's called stress-induced cardiomyopathy, or Takotsubo cardiomyopathy, where the heart literally is stunned because of stress and that catecholamine surge. And that's just one example. Obviously, with stress, you have release of the stress hormone cortisol. Elevated cortisol in your blood is for chronically is not a good thing. In the immediate term, it's actually really good. I mean, it helps you avoid car accidents. It helps you get out of scary situations. So the stress response in the body is very important. But when you're subjected to chronic stress on a daily basis, it leads to a lot of other downstream effects that we aren't often aware of.
Yeah.
And again, you could also go into a whole discussion about stress as it pertains to things such as financial security, personal security, or food security. Mm-hmm. We don't often think about that.
Right.
There's a lot of Americans, a lot of South Dakotans that don't have access to healthy food. They don't have access to much food at all. a lot of that is, I mean, you could really open up a can of worms in trying to parse out why that is, but it's a stress response. If you are probably going to have dinner tonight, you probably know where it's going to come from, and you're going to have breakfast tomorrow.
Right.
Not everybody has that. Not everybody has that assurance. Some people are physically and literally stressed about where their next meal is going to come from, whether or not they're going to have a job when they come into work the next day. And those are the types of stressors that you see in a lot of disparate income communities, where you see a lot of I don't know if you've heard of the term food deserts as well.
Yes, absolutely.
Where a food desert is basically a community that is actually in a city or a town where you just don't have access to healthy food, and those types of stressors are real to people, and they adversely affect people in many ways. But I won't go too far off track on that. But I just wanted to point that out, that stress management is very important. Right. Especially when it comes to other stress areas in our life that are personal to us, like our work or our families. Those are often tremendous sources of stress for a lot of people.
Now, the last one, I think the last pillar you can talk about here then could kind of go hand in hand with that stress part in helping to manage it a little bit.
Yeah.
And that would be the social connections that are a big part of this, right?
Absolutely.
So maybe those two go a little bit hand in hand, and you could kind of talk about why those are important.
Yes. So healthy relationships. That's so actually I kind of want to, I don't know if you can plug Netflix documentaries on here.
Sure.
But there is a documentary that I would recommend all of you watch if you have a couple evenings. It's called Live to 100 by Dan Buettner. It's on Netflix, and he goes around the world and he talks of what's called blue zones. Have you heard of?
No.
So blue zones is it's a term that was coined a couple decades ago about pockets of populations around the world where people live abnormally long.
Oh, okay.
They live an abnormally long period of time, and Dan Buettner did this series about these blue zones, and he was examining, what makes these people different? Why are these people living to 90 commonly?
Right.
And you see, several people living to up to 100 years, and you don't commonly see that, obviously, which, by the way, I don't know if you knew this, but the life expectancy in the United States is actually declining. So that's fun. But seriously, no, this is actually so he looks at a lot of these blue zones and a lot of the common themes that he sees between them all, and one of which was healthy relationships. And that is, and that can take many forms. And that can be the form of a social group or a close-knit community, communities that are more, I guess you would say, interconnected, more kind of accepting and wanting to socialize and interact. And he also looks at religious groups, individuals that can come together as a common faith tradition and find solidarity in that and find community in that. And they found, and by the way, Loma Linda is a blue zone. I don't know if you knew that.
No. Wow.
So, but anyway, it's very important to kind of understand that we were engineered to be social creatures. We're designed that way. We are supposed to spend time with one another. We're supposed to have fun. We're supposed to, get out and enjoy, the sunshine and whatnot. And so, it's tough to suggest that to an American living in 2024.
Yeah.
Living, paycheck to paycheck. But at the same time, it's really important to realize that in our pursuit of, like success, or in our pursuit of being stable, productive citizens of this country, that we don't forget the common bonds of humanity that we have with one another. And it's often lost, and I think in the information age, you've lost a lot of that. Again, this could be another podcast, but
well, you can take almost any of these pillars and really drill down.
You really could,
as to why they're important.
Yeah. I mean, you really could, and so.
Well, to kind of wrap this up, then, Doctor, what do you recommend that people should be doing regularly? Checkups, tests, these sort of things. We know we got to eat right, exercise, be social. But at the same time, we also got to go to the doctor, all right? You should, every year, I'm a big proponent, find a family doctor and see him all the time, right? Or her. But what do you recommend that people should do just to keep your heart where it needs to be?
So, in addition to these concepts we've talked about today, following up with your doctor is an important piece. To health, because that is a trained professional in the medical arts who is attentive and understanding of the way the body works, and going to that individual and saying, it's like, getting your cholesterol screening, getting your blood pressure screening. Don't start smoking tobacco. If you have, then quit smoking. There's a lot of prescriptive things that, we've kind of covered. Exercise, being active, staying engaged. But it's kind of like the first step to solving any problem is acknowledging the fact that a problem does exist. And
right.
there's a quote that I wrote down that written in the Chicago Tribune in 1975. It said, "The idea of preventive medicine is faintly un-American. It means first recognizing that the enemy is us. We are responsible for our health, and it's so important to understand that a pill's not going to fix that. A pill is actually the end game.
Mm-hmm.
The pill is the last resort. You have a whole lifetime of opportunities to try to create a healthy body, trying to live a healthy life, and it's not a pill is going to fix it at some point. The pill is what I hate prescribing pills.
Mm-hmm.
I don't like to do it because it's kind of an admission that we didn't do it,
right?
And so now we have to settle for a medication. Now, don't get me wrong; they can be life-saving interventions. And if a medication is prescribed by your provider, that is something that we would recommend you do. But it's so important to just recognize that, there's a lot that we can change about ourselves, and oftentimes it's going to be a hard process, but knowing that it is a process, it takes time. Rome wasn't built in a day.
Right.
Show yourself some grace. It's okay.
And it doesn't have to be that hard. It is, like you say, just a few steps, extra steps. Park a little further away from the building than you normally would, right?
Yeah.
Take the stairs to come up, like you said. As much as you don't want to choke down 5 pieces of broccoli, just do it. It's not that hard, and then you can still go for the good stuff afterwards anyway, right? You're still getting it into you at some point.
Yeah.
Well, Doctor, this has been a great conversation. I'm so glad you came in to do this.
Yeah,
and like I said, we'll have you back and we'll go deep into some of these things if you want to.
I would love to.
I can tell.
I would actually love to dig into some of these more because it's a multifaceted problem. It goes just beyond just eat right and exercise.
Right.
It is, the body's very complex, but yeah, I would love to. I would love to at some point. That'd be great.
Dr. Stephen Wasemiller, non-invasive cardiologist at Monument Health's Heart and Vascular Institute. Thank you for coming in, Doctor. I appreciate it.
Thanks so much. Thanks for having me.